All right, Dr. Kupper, thanks so much for being on this podcast. I appreciate it. My first question that I have for you is, just tell the audience a little bit about yourself and how you started in the mental health space.
Sure. Thank you so much for having me. My name is Dr. Amy Kupper. I'm a licensed clinical psychologist in the states of Washington and North Carolina. I am currently in private practice in the Seattle, Washington area, and I see clients who are adults, some of whom are struggling with things like depression, anxiety, PTSD, but another half of my practice is focused on chronic pain. And so I see a lot of adults who are experiencing pretty debilitating chronic pain. And then your other question was, how did I get started?
Uh-huh, yeah.
Okay, great. Well, let's see. I always was passionate about the mind-body relationship. As a kid, always knew I either wanted to go into the mental health world or the medical field. And over the years, I learned that there was actually a way to do both by being a health psychologist. And so that happened in college. I learned about the opportunities in medical psychology and behavioral medicine. And that motivated me to explore some research opportunities in Seattle. So I had the chance to work in the rehab medicine department at University of Washington and do psychological research there with some incredible researchers. And I just fell in love with what I was doing. So I went to graduate school for that after doing a couple years of research, worked in some pain management clinics and led a pain psychology program there. And that led me to where I am today, where I am my own private practice and I get to work with people who seek me out for some specific pain management modalities.
Mm-hmm. And speaking of pain management modalities, what are they? What do you use?
Yeah, great question. There are probably three main ones that I use. We've got cognitive behavioral therapy, which we know is really helpful when it comes to chronic pain. So that's identifying negative thought patterns a person might have with pain, maybe some behavioral things that they're doing that are not helpful, and using strategies like behavioral activation, cognitive restructuring to get them back to the life they want to live. We also have acceptance and commitment therapy, and that involves kind of getting to a place of acknowledging the reality of the pain while also committing to living to a life that feels meaningful. And so identifying values that are important for that person and figuring out creative ways for those values to still be things that a person can live out, even with limitations and pain. And then the more recent modality that I've started to use is something called pain reprocessing therapy. And that's something that I'm really fascinated by and passionate about. That's an intervention where we essentially are trying to retrain the brain to interpret pain differently. So it retrains the brain's pain pathways. So essentially, sometimes the brain gets stuck in alarm mode and keeps on sending pain signals even after, say, an injury is healed. But this modality teaches people to recognize those signals as safe, calm the nervous system, and over time, it actually reduces or can even eliminate the pain. So even though the pain is real, the brain can learn new patterns and actually no longer activate that pathway that was causing the pain.
Mm-hmm. So could you give me an example of if someone could you give me an example of what that might look like if someone had pain in some part of their body? How would that sort of modality come into fruition?
Yeah, absolutely. Great question. Sure. So let's see. Let's take someone who maybe a runner who all of a sudden sprained a muscle or tendon in their leg. And so what would happen is that person would experience some acute pain that would probably keep them out of running and activity for a while. However, sometimes even after an injury has healed, the pain sticks around. It becomes chronic. And this can happen even when someone has gotten lots of scans that show that there's no longer any structural damage. Everything looks fine, but the pain the person is experiencing is still there. So, what can happen is the brain is misinterpreting safe sensations as dangerous. It's essentially staying in alarm mode. So we help use pain reprocessing therapy to retrain the brain to calm those signals so that the person has decreased pain or sometimes even eliminate that pain and the person can get back to those activities in their life. Um, the three components of pain reprocessing therapy are using mindfulness. So that's essentially focusing on the present moment intentionally without judgment or fear. So sometimes that means asking a client to be curious about a sensation in their body rather than feeling fearful. The next one is called safety reappraisal. What we do there is we actually focus on the sensation that's hurting, but we send messages of safety to the brain. So that could be through just looking at the evidence that we have that this is not a structural problem. We'll say, hey, your last MRI scan was totally clean. There's no reason for this pain. This pain is your brain misinterpreting this as a dangerous sensation rather than what it actually is, which is just a neutral sensation. And then the last one is, keying into things that feel positive in the body. And so that could be at the same time, checking in with your breath, noticing how good it feels to be doing some deep breathing or noticing parts of the body that don't hurt, that feel good even, or generating a positive sensation by, noticing how good it feels to like rub your hands together. Um, those three components we use through some exercises called somatic tracking to help essentially retrain the brain to decrease the pain signals and the danger signals and essentially just feel safer in the body, which also results in less pain.
Mm-hmm. You gave an example of how of a runner and how that sort of modality might be used, but what about someone, who has a spinal cord injury or who has recently become paralyzed for a car accident? How does that apply at all? And if so, how?
That's a great question. Yes, absolutely. Certainly. So with some people who come to, you know, find this modality, they never had an injury before, had a injury, and they're, recovered. However, that's definitely not always the case. I've worked with a number of people who have spinal cord injuries, and obviously with some conditions like a spinal cord injury, there is clear structural damage, right? I would not ever say hey, there's nothing wrong with the spine here, because we know that that's just actually not true. However, the level of the pain that is being generated may be out of proportion to what is expected. And so, say, there can be very understandable neuropathic and musculoskeletal pain that's associated with a spinal cord injury. However, if someone's experiencing 10 out of 10 pain every single day and their team says, you know, with this is much higher than we would expect, we can still use pain reprocessing therapy because it can help to de escalate the level of pain the person is experiencing. So we're dealing with a structural component for sure, but also there's likely some element of what this modality calls neuroplastic pain that is amplifying that. And so if we can send safety signals to the brain that can in my experience, bring that pain level down from a 10 to perhaps a 5.
Mm-hmm. And so, like, what have you learned in like doing this kind of work?
Yeah, great question. Um, I'm fascinated by just studying pain and the brain. It's just something I could talk about all day and research all day. But more than that, I think I have just learned how resilient people are. And that has been truly inspiring. I feel really, really lucky I've gotten to meet some of the people I've met. I mean, really everyone I work with, that they share their stories and that they're willing to be vulnerable and open and engage in this journey towards trying to ultimately have a better quality of life. And so, yeah, I guess just noticing the resilience of the people I work with and just really feeling just deep gratitude that I get to do this work.
Mm-hmm. Is there anything that you'd like to learn in terms of something new, or is there something new that you want to learn within what you're doing now?
Absolutely. I I wish I've always just loved learning in general, and so there's so much I want to explore more. But in my niche of pain management, I think that there's a lot of other things I want to explore. So I'm planning on taking a training on hypnosis for cancer pain in the next couple months. I just want to learn more about different modalities that I can use to help people who I'm working with. I am, have knowledge and have used some interventions like IFS or, emotional awareness expression therapy, but I'm not an expert, and those are things I'd like to get some real deeper expertise in as well.
Mm-hmm. And for those who want to combine, because I know earlier you said you combined the psychological model and the medical model to do what
Mhm.
you're doing now. So what advice would you give to those who want to study what you're doing?
Sure, yeah. I think that really just looking into what health psychology is. It's really just the understanding that there's so much we can do when it comes to someone's physical health. And that could just be things like, how can we improve quality of life? How can we help someone cope with their health? There are probably, I'm sure that there are some excellent intro books on health psychology out there. If someone was in college, that would be a great question for, say, an advisor. But if someone is not, I would just, you know, get a introduction to health psychology book and just start to explore it a little bit. And try to, if you know of someone who's practicing, ask them if they know of someone. I think talking to people who are in the field and just kind of getting more information on how they got to where they are, can just be really helpful. And I know I had a lot of people who helped me out when I had questions about how do I do this professionally. And so I think just don't be scared to ask questions and ask for advice.
Mm-hmm. All righty. Okay.